Hi, and welcome to this podcast where we're going to tell you all about the CoSTED trial, Cessation of Smoking trial in the Hospital Emergency Department. I'm Caitlin Notley. I'm Professor of Addiction Sciences based at the University of East Anglia.
And I'm Ian Pope. I'm a specialty doctor in emergency medicine at the North Norwich University Hospital.
And together we are co-PIs of the CoSTED trial.
So the CoSTED trial is funded by the National Institute for Health Research and led by researchers from the North Norwich and the University of East Anglia. The sites it's taking place at is the North Norwich, the Royal London, Homerton Hospital, Leicester, Edinburgh and Adam Brooks in Cambridge. And you can see the PIs for each site listed here. I'm now going to hand over to Caitlin to give you an overview of the study.
So the cost of tobacco smoking is a huge burden on the NHS in terms of treating tobacco-related illness and disease, costing over £2.6 billion every year. In the development work for the CoSTED trial, we found that approximately a quarter of patients attending hospital emergency departments were current daily tobacco smokers. This is much higher than the national average, which we estimated around 15% of the wider population. Most tobacco smokers want to quit smoking if asked. And in fact, many smokers will have tried and failed to quit many times before, but they currently lack support and don't know how to make that successful quit. The policy clearly states through the NHS long-term plan that we should be supporting smokers to quit at every contact with a health service by the year 2023. Attending the hospital emergency department for many people can be a teachable moment where they are able to consider their own health behaviour. Perhaps the presenting condition makes them think about the impact of smoking on their health in the long term. Also, sitting in the emergency department for many people can be quite a long time where they're able to sit and reflect, read information and think about future changes to health behaviour. There's very good evidence for e-cigarettes as a way of supporting people to successfully quit smoking. A recent trial found that e-cigarettes were more effective at supporting smokers to quit than nicotine replacement therapy. And e-cigarettes are now the most frequently chosen method of support for people choosing to quit smoking themselves in their own time. So following on from this, the objectives of the CoSTED trial are to definitively test the real-world effectiveness of an ED-based smoking cessation intervention. Alongside this, we will assess the cost effectiveness of the intervention to see whether it actually saves the NHS money. We will also be undertaking an embedded qualitative process evaluation study to look at factors such as intervention delivery, how the intervention is received, whether it's possible to deliver the intervention successfully within the hospital emergency department.
So a bit about the trial itself. We're going to recruit patients from the emergency department waiting room. They'll then be randomised to either the control group, in which case they'll just carry on with their ED journey, or the intervention, in which case they'll be receive the intervention from a dedicated member of research staff whilst in the emergency department. They'll be given advice on quitting smoking, offer of an e-cigarette starter kit, and referral to a stop smoking service. We'll then follow them up 6 months later in both groups to check smoking status. If you have any questions about the trial, please do get in touch at costed@uea.ac.uk or tweet us at CoSTED Trial. Thank you very much for listening, and we hope this has been helpful.